We see a few kids each year that come in. Typically, as an orthopedic surgeon, we're seeing the worst of the injuries, and there's many that happen that I'm sure that the ER physicians handle that don't even come to us, from small lacerations to burn injuries to the things of that nature. But we see the bad ones when the kid actually comes in contact with the spinning blade and has a pretty severe injury to their, usually the leg, is what we see. So, and it's fortunately only a few a year, but the injuries are devastating nonetheless when they do happen.
And as we were talking before, usually it's a family member like your child or grandchild, and just the mental aspect has got to be even harder on the whole family. Not only having an injured kid, but they feel responsible, I'm sure.
Absolutely, yeah. One of the hardest parts of the injury is the family side of things. The person, obviously the child's injured and they have their immediate medical needs that need to be met, and they have to recover and heal and all that sort of thing. But eventually that is done and the child gets back to doing their normal activities. But in the cases where there's been an amputation or more severe injury, the family members really are the ones who feel kind of guilty about the whole thing. There's a lot of long-standing hard feelings that go on with it. If you can imagine, you're out for a sunny day mowing the yard and all of a sudden you run over your grandchild or your son, and it's a life-changing event, sometimes life-threatening event, and the guilt and the feelings that go along with that in the long term can be profound.
Mike, talking about all the information, these are most of them are preventable when it comes to, especially with little kids.
They are, yes. Most of the injuries are preventable, we feel. Clearly there are freak accidents that happen, and there's nothing you can do about those types of things. But the recommendations of the American Academy of Pediatrics are to have your kids inside the house, so they're not out around an operating lawnmower, especially when they're under the age of 5 or 6. They should just not even be out there anywhere. Those are the things that we think are preventable. Things where the child walks up behind a riding lawnmower and the family member doesn't even know they're there. Backs them over and hurts them fairly severely. Things of that nature. Certainly if the child was just watched in the house with a responsible child or adult to keep them in the house, that could clearly be a preventable injury. Things can be thrown from lawnmowers, projectiles. I mean, it's just, it's a powerful piece of equipment, and it can do some significant damage if you're not careful.
We were talking about how fast something gets thrown.
Yeah, one of the interesting statistics that you can find on lawnmowers, an average 22-inch lawnmower with a blade spinning at 3,000 rotations per minute can eject a projectile at 3 times the muzzle energy of a .357 Magnum handgun. So it's kind of like being shot. And if you think about it, everyone has encountered lawn crews doing their job, or walked next to a neighbor mowing his lawn with a side discharge chute, and having all of that grass and things blown out at you. You almost worry about that maybe too. You wouldn't want to get shot while you're walking down the street, but if something discharged from that lawnmower could easily hit you with the same energy of a handgun. So something else to be watching for.
As far as most kids' recovery, I'm sure their age helps.
Yes.
Still.
Yeah, so the kids that get injured, usually there's 2 groups. One is the group under age about 2 to 5, somewhere in there, that get run over or hit by a lawnmower when the family member doesn't see them. And then the other group is the 15-year-old age group that's actually using the lawnmower, to do a job, help the family, that kind of thing. The age definitely helps. The younger you are, the more healing potential you have, the better things go for you in the long run. Even a child with a significant amputation will adapt to that and actually function very normally overall as they get older.
Anything else I'm not thinking to ask you? Any other tips or anything?
Probably the ages.
Yeah.
One of the important things brought up by the American Academy of Pediatrics in regard to using a lawnmower is recommended age groups. So the official recommendation is that a child should not use a power lawnmower until about the age of 12. That's a push variety. For a riding lawnmower, it should be age 16. Some of the other injuries that you see with these two aren't just the blade type injuries where the foot gets caught and mangled, but burn injuries from touching a hot muffler, injuries where the engine's not cool and it's being refueled, where there might be a flash fire, something of that nature. Cleaning a mower that's still hot. There's just lots of other things to pinch your hands on and get caught up in. So there are other injuries besides just the most dramatic ones, like I mentioned, that we see, but certainly account for some of the high injury rates. And lawnmowers do have one of the highest injury rates of consumer products, according to the Consumer Product Safety Commission. So they feel that the safety standards, and the Academy of Pediatrics feels the same way, aren't enough, and they need to be more, people need to be more educated on this issue to have their kids have a good experience using a lawnmower, being safe about it. I had a job mowing lawns when I was a kid, made good money. I understand it's families need help with that sort of thing. It can be fine, it can be done in a safe way, but you have to take the necessary precautions ahead of time.